think fundamentally the greatest challenge in American healthcare is having skilled, experienced nurses at the bedside. And the estimates are that we will be 1 million nurses short by the year 2020. We turn over nurses. I think nurse turnover is absolutely a very good indicator of the cultural health of an organization. We can look at places like Dana-Farber in Boston, who are all about the patient in the bed, all about the people at the bedside, who turn over 1 in 250 a year, 0.4%, when a national average is probably 10 to 12%, and we can certainly see healthcare systems, big hospitals, that turn over 20, 25% of their nurses a year. If you're thinking about, and this is something I would say to nursing students and other folks, which is if you're going to choose to go into a healthcare organization, go into one that has a rapid response system, one that has a very robust process of improvement and safety, and one that clearly has a culture of respect, because that's where you want to spend your time, and that's where you're going to create value for patients and yourself.
As we, myself included, age, how are we repopulating and how are we educating people and encouraging people to go into the medical field? Same with pharmacists. Pharmacists are hard to find. And I think oftentimes in nursing, we create a job that it's very hard to be successful at because there's so many things that are going on. There's so many tasks, and we want them to feel successful. We want them to go home feeling like they helped somebody. Even if somebody was still in critical care, we want them to go home feeling successful, or they will move on. They will find something that makes them feel good.
Well, I don't think there's any question that the biggest challenge in the American healthcare system is to cut the cost in half. And I think there's no question we could do that. We know how to cut the cost in half. And we've got to do it to keep from bankrupting ourselves, and we've certainly got to do it if we're going to provide care for all Americans. Chronic disease accounts for 70% of the healthcare expenditure in America. 70%. We now spend $2.1 trillion. 70% of that is 1.4 and change. That's accounted for by a handful of conditions that we're all familiar with: coronary artery disease, depression, asthma, diabetes, and congestive failure. Those 5 account for most of that 70%. And we know now, we have the knowledge of how to cut that cost in half. And that would save us $700 billion a year. And the way you cut it in half is to provide comprehensive, multidisciplinary team care in which the patient care is a continuum, not episodic, where they don't go to 10 different doctors in 10 different offices at 10 different days of the week, but are taken care of by a group who organize and plan and coordinate things with the objective of keeping them out of the hospital and keeping them away from the high-tech, expensive care.
The biggest one I think that I've seen working in healthcare and as a student is sort of the cost to the healthcare system. And I think at this time in history, we're kind of facing a unique challenge. There's a lot of baby boomers that'll be retiring, and as people get older, unfortunately, they need more care. There's a lot of uninsured people too, who utilize sort of emergency rooms as their primary care sort of site, and so all of these costs sort of add up to the healthcare system. I think we spend a lot of time and effort and energy developing all these great technologies, which are wonderful, but there's a cost to them, and it's a huge cost. And we really don't focus as much on prevention, I think, and educating people and helping them change their behaviors and lifestyles. So I think if we'd ask, just about anyone on the street, when you're 65, would you rather be healthy and do whatever you like, or would you rather have, arthritis and diabetes and heart problems? I think they'd say, I'd rather be healthy. So I think we really need to spend a lot more time and resources sort of keeping people well is what I hope our ideal goal would be in healthcare. Getting people to change behaviors is a difficult thing to do, but I think it's really where we have to focus a lot of our efforts.
I think the most visible challenge the healthcare system will face is that of costs and the pressure in society on hospitals and other providers to reduce costs. The good news about improving quality and safety in hospitals and other provider environments is that it increases the efficiency with which those organizations run, and therefore helps control the level of cost increases. We know, for example, that if we avoid a case of ventilator-associated pneumonia in our hospital, it saves about, on average, $40,000. People do not inure to the benefit of the hospital. They actually go to the benefit of the insurance company. But that's fine, because it also means that if a patient is out of that ICU within a few days instead of spending 3 or 4 weeks because they have pneumonia, then we have room for another patient to come in. So there is an economic imperative or a financial imperative for a hospital, but there's a broader societal imperative as well.
As a patient who has, in the last 4 years, utilized healthcare a lot, because I got MRSA after a surgery, blah, 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 so I've really been in and out. I really don't think anybody's listening to me and not valuing my input about my own body, and that disturbs me. Why wouldn't you look at me? If you're the doctor, nurse, pharmacist, as a woman who's 45, who has had 24 plus surgeries, why wouldn't you think I would be a valuable resource regarding my own body? You need to stop dismissing us and listen, because we might have some good information.